we have been able to enter around 15 trucks since the start of the ceasefire. It doesn't mean that we're able to enter everything that we need. We've had a number of trucks denied as well, which has been the case for other aid organizations as well. And this is indeed a pattern that we have observed in the last 2 years, that there's bureaucratic impediments that are being put in place to make the work of humanitarian organizations more difficult than it should be. So the most complicated remains the dual-use items, even if we have been able to enter some of them in the last few weeks. But so issues that have been complicated are so as we call, well, as the Israeli authorities call it, dual-use. So technically considered could be used for either civilian or military use. What this means for us is material for water purification. What this means for us is spare parts for cars, for washing machines, for sterilization materials at the hospital, external fixators that we need for our patients to stabilize the bones that they have broken in the most horrific ways. And so while we have been able again to enter now some of that, we're still not at the level that we want it to be, purely for bureaucratic reasons. So these are bureaucratic hurdles indeed put in place by the Israeli authorities. And again, this is something we have been seeing for the last 2 years. It is nothing new at all. It goes against, of course, the ceasefire agreement that 600 trucks per day would enter. This is not at all what we are seeing. And it has really been what we experience, a deliberate attempt to limit assistance coming in, and which is very much directly impacting, of course, not just the organizations, but the Palestinian people who are being denied the access to humanitarian assistance that they have a right to. And indeed, we are talking about paperwork that is denied. We've had cases of trucks arriving at the border being denied, and those same trucks with the same paperwork being accepted 2 days later. So one can only wonder what is really the issue, other than, again, bureaucratic impediments that should never be put in place on purpose for humanitarian assistance. What we have been witnessing here in Gaza for the last 2 years is a genocide. What we have been witnessing is people being killed, a health system being deliberately destroyed, people being denied access to water, access to food, access to medication. And this impediment of humanitarian assistance, it's difficult to not just see it as part of that wider genocidal campaign. We are very concerned about people's health status as winter comes. Already it's something that we've been noticing for a long time. In our primary healthcare centers, we see people with conditions directly linked to their living conditions. Many skin infections, for example, because it is not possible to keep a minimal level of hygiene if you don't have access to water, if you live in a tent. And with the weather turning colder at the moment, it's still nice and warm during the day. It's starting to get cold at night. And of course, this will only deteriorate in the coming weeks. Hundreds of thousands of people are living in tents, or not even tents. There are people under the open skies. There are people in improvised shelters that will not be able to protect them from the elements as the weather gets worse. They don't have access to enough blankets. They don't have access to enough mattresses. And so even if that's a sector that we are not working in directly as medical actors, we will for sure see the consequences of that in the coming weeks in our patients.